India has a population of 1.35 billion. One baby is born every 3 seconds. Consider some other statistics. 70% of the Indian population lives in rural areas, which is served by only 20% of doctors in India. There are about 25,000 primary health centers. 90% of them do not have proper facilities and staff. India produces 50,000 doctors every year. But India continues to struggle with a shortage of doctors in rural areas. Amidst all these alarming statistics, we still have hope. The future of healthcare lies in working hand in hand with technology, and healthcare workers have to embrace technologies in order to stay relevant in the coming years. Technology could help transfer unsustainable healthcare systems into sustainable ones and provide cheaper, faster, and more effective solutions. Sevati Devi Memorial Digital Medical Centres Private Limited is committed to harnessing technology to provide world-class healthcare to anyone, anywhere, anytime at low affordable cost instantly. Sevati Devi Memorial Digital Medical Centres proposes to set up a network of state-of-the-art digital healthcare centres across the country on the lines of the Mother Dairy booths, and also have visiting digital doctors. Digital medical centres shall be connected to a network of consultants from different medical specialities through broadband for transmission of voice, images, data, and interactive video conference. The data of these consultants shall be available on cloud, thus creating a virtual hub. Digital Medical Centre would need approximately 200 to 300 square feet area and shall be run by an MBBS doctor on franchisee basis. It can be set up anywhere, the only mandatory requirement being the internet. These centres shall be like a hospital OPD, where the doctor shall create an electronic medical report, that is, EMR of the patient, record his complaints and history, and examine the patient, but with complete digital infrastructure. The general examination shall be done with the help of a high-definition general examination camera and the digital pictures captured in the computer and attached to the patient's file. Similarly, chest and heart examination shall be done with digital stethoscope. The heart and lung sounds captured and attached to the EMR. ECG shall be done with the help of paperless digital ECG machine and attached to the EMR. Examination of the eye, ear, nose, throat shall be done with the help of digital ophthalmoscope, ENT scope, and videoscope. The images and videos thus captured shall be attached to the patient's EMR. A digital microscope shall help in the examination of blood and urine samples. The images of the slides shall be recorded in the EMR. A computer-compatible digital X-ray machine and a digital ultrasound machine shall capture the images of the X-ray and ultrasound that get attached to the patient's electronic file. Now the patient file is complete with details of his history, examination, and investigations. The images, sounds, and videos attached are of diagnostic quality. The doctor, after viewing the file, shall prescribe the necessary treatment. This prescription shall be attached to the patient's file. A copy of the prescription shall be mailed to the chemist with the patient's details, date, and time. The patient's EMR, consisting of data, voice, and image library, including video clip, shall be stored on cloud permanently. In case the patient needs consultation from a specialist, the doctor at the centre shall connect to the desired specialist. The patient's file shall be retrieved and shared between the doctor and consultant. The consultant can be anywhere. The remote consultant, no matter where he is globally, can see the patient, talk to the patient and see his medical history, investigations done, see the examination being done by the doctor at the DMC, or also do the examination himself and advise the doctor at the Digital Medical Center on the further line of action regarding investigation and treatment. The patient's electronic file gets stored in the cloud after the encounter is over. It can be retrieved at any digital medical center during any subsequent visit of the patient. Therefore, the past history of the patient shall be available anywhere at any satellite center anytime for any consultant in the form of audio-visual text file. In this way, a virtual patient is created in front of the remote consultant at the virtual hub, and a virtual consultant is created at the digital medical center. At the virtual hub, the consultants from different specialities shall be available to ensure proper diagnosis without any delay in treatment. The DMC shall also have multifocal video conferencing facility, which would enable the consultant at the virtual hub to discuss the serious patients and get the opinion from the other consultants and institutions in India and abroad. Thus, the patient shall be able to access the best medical expertise without having to suffer heavy expenses and the inconvenience of traveling. In case the patient requires tertiary care or surgery, he shall be referred to the appropriate hospital. A digital medical center with a standardized equipment, network of consultants, and franchisee doctors can be set up anywhere in the rural, urban, or calamity-affected areas, running trains and sailing ships. Visiting digital doctor. For patients who find it difficult to travel, a visiting digital doctor shall see them at home. He shall carry all the digital equipment, except for the X-ray, in a kit bag and examine the patient completely as in a digital medical center, prepare the EMR, and treat the patient himself or get consultation. Ride-hailing apps shall provide transportation to the visiting doctor to make travel comfortable, convenient, and less expensive. Benefits to the doctors. Invariably, when a batch of doctors graduates, approximately 15 to 20% of them get government jobs, another 15 to 20% go for postgraduate studies. The remaining, about 60% doctors, struggle for jobs. This system shall provide self-employment for these young doctors. It shall enable them to practice anywhere, in the big towns or small villages, and yet remain connected to consultants and hospitals, thus get continued medical education. A doctor at a digital medical center shall earn more than the salary a fresh doctor gets in a government job. The equipment shall be financed by the bank. Benefits to the patients. The patient need not travel anywhere. It is the hospital coming home rather than the patient going to the hospital. He shall not be exposed to hospital infection in crowds, thus maintaining safe distancing. Better and safe data storage. Patient's electronic medical record shall not only be available anywhere at the click of a button, but shall help increase accountability and reduce malpractice, reduced healthcare costs, and superior healthcare experience. Benefits to the consultants. EMR offers an overview of patient's health, allowing a more accurate diagnosis. Increase in the productivity, as the system is time-saving. Increased catchment area, as it makes them available to more number of patients. Cost saving on travel, cabin rent, car running, maintenance expenses. Benefits to the government. A state-of-the-art primary healthcare infrastructure on pan-India basis at no cost to the government. A very large opportunity for self-employment. Quality healthcare shall reach the common man everywhere. History and accolades of the project. In 1995, the first presentation of the project was made to the IT companies in India. In 1999, this project was presented at the Telemed 99, a conference organized by the Royal Society of Medicine, London, and American Telemedicine Service Providers Association. In the year 2000, it was presented at the American Telemedicine Service Providers Association Business Forum in Minneapolis, USA. In 2001, it was selected in Luxembourg in the Telemedicine and Telehealthcare Trade Fair as a key project by the European Commission. It was sponsored by the United States Trade and Development Agency for participation in a competition of Asian countries, Healthcare in Asia, New Technologies, New Options, where it received a standing ovation. In the year 2001, it was awarded Gold Medal for the excellence in the innovation of technology when a prototype of the project was exhibited at the India International Trade Fair in New Delhi. In 2017, it has been accepted for presentation at the ICHIT 2017 International Conference on Health Informatics and Telemedicine held on April 16th and 17th in Lisbon, Portugal. Collaborations and Letter of Intent. The project received a large number of letters of intent and collaboration offers from many Indian state governments like Goa, Meghalaya, Odisha, Maharashtra, Tamil Nadu, NCR, Punjab, Jammu and Kashmir, Mizoram, Uttar Pradesh and Haryana. Large corporates showed keen interest in collaboration and investment. Some of them are Konkan Railways for setting up DMCs at Konkan and Indian railway stations all over the country. Larsen & Toubro for developing and installing prefabricated DMCs globally. American Medical Development USA. Telenor, National Hospital of Norway. Many workshops were conducted both in India and Norway, but the project was futuristic and the technology was not in a position to support the project, and we had to wait and watch the developments. Today, with the advancement of technology, the technical hurdles are over and the technology is now available. It is now your chance to be a part of this grand medical enterprise. The intellectual property rights of the project are with Dr. Arvind Agarwal,